founder essentially is presented as a lame horse bilaterally, and typically the front limbs, but they can founder in the hind limbs as well. What we see is that it's inflammation of the lamina, or the supportive tissue along the dorsal wall of the coffin bone itself, P3 here, third phalanx, okay? And what the horse presents as is that they'll have a very, very stiff, stilted gait. They'll be very reluctant to move, and they will be a tremendous visible discomfort on trying to pick up one foot and check the other one, this sort of thing. And what we will see is they will test sore right at the toe, where the coffin bone essentially has lost its support and is making more and more sole contact, or where it's maybe possibly rotating a bit down into the sole. We also notice that these horses, besides having this extended gait to where they're trying to position their feet out in front of them, they will also have a tremendous amount of pulse in their both front feet. And it's very, very discernible. You can pick it up right away by reaching around. I put my hand around the horse's foot and I check the pulse right here, and you can feel it right here, the digital pulse, they call it, right here along the pastern. And you can pick up the foot, and actually, in cases that have been going on for a while, you can see the actually outline of the coffin bone itself along the sole, and which we don't see here, but you can in horses that are chronic. What do we do about it? Well, therapeutically, you got to address the inflammatory process as soon as possible. So anti-inflammatory drugs. There are also drugs that will increase the circulation to the foot to try to help the area that's becoming starved from blood. Acepromazine is one drug that works really well. Phenoxybenzamine is another one, which is an alpha blockade effect, which essentially stops this arteriovenous shunt that stops the area from getting circulation. So it's really, really necessary to both for anti-inflammatories, phenylbutazone, Banamine, and phenoxybenzamine or acepromazine get in to stop this process, so we don't starve this area, so it gets back some normal nutrition and blood supply to the area. Mechanically, some guys will put a reverse shoe on a horse, so you make a little bit more sole contact and less, or heel contact and less sole. And basically we'll put a pad on here to make them comfortable to where they don't make it. But you basically you should be directing your therapy toward increase in circulation, decrease in inflammation, and giving support to the back part of the foot so you don't make so much contact here. Another thing that works really well is to put the foot or submerge it in cold water and or ice to take as much heat and inflammation out of the foot as soon as possible. And try to get it stopped and reversed as quickly as possible, so the longer it goes on, the more support you lose in this dorsal wall, and the more circulation you lose, and therefore more rotation you get, which the horse eventually can succumb to, and the coffin bone can come through the sole of the foot. As far as maintaining feet, you've got to make sure the horse's overall health is maintained in order to not have these secondary or compensatory problems. Sometimes laminitis is not the primary cause, but it's a compensatory problem. From pneumonia, from colitis, from colic, from a number of different things, or just from overload. If you just overload one limb, if a horse is not symmetrical. We always talk about symmetry. So, if a horse can have an abscess in one foot and overload the other foot, they can founder in the supportive foot because it just has too much load on it. So that's the one thing you have to be aware of. Whenever you have a primary problem, secondary problem of laminitis or founder can be the thing that you will lose your horse to.